It's been ever evolving. You know, some of us, we talk about when we think about information coming out, and some I've heard say, you know, sometimes we're living in dog years, where a year we get 7 years worth of information. I think it's now the era of living in COVID years, where we get information that dramatically changes our understanding of both testing and preparedness and response, and it can change by the hour. So like many of our colleagues and all of our citizens globally, you know, we've been affected. We've learned a lot about test, not only distancing, but more appropriate aspects and specific aspects for medical distancing as it relates to our cancer patients, and trying to figure out ways to better optimize and prioritize diagnostic as well as therapeutic and surgical interventions. And so we're learning all together. We're absolutely taking advantage of telehealth, telemedicine, trying to keep patients safe, to keep our healthcare teams safe, to keep resources utilized with a real care towards avoidance of excessive depletion. And at this point in time, the infectivity rate is clearly gone down. I think I look at us as we're in the acute phase, the reaction phase, infection, second, third waves, especially when we get back into the autumn and winter months. So preparedness, the preparation phase is important. All along, it's up to VJOncology providers and all healthcare providers, but especially those who practice oncology, to be stewards and champions for our patients and reassure them that if they're not being put to the early part of the list for treatment or surgery, or if their treatments are changing, that we have to reassure them that we've given great thought to doing this, that's not jeopardizing their response to care.